Hello everybody, I want to introduce myself. I'm Dr. Darrigade and I'm a dermatologist and an allergologist. I work in the University Hospital of Bordeaux in south of France, and I realized in my unit some collective session of therapeutic patient education. I'm also a member of the GET, the group of TPE in France, and we wanted to reference all the tools used in atopic dermatitis TPE in France. So we sent a questionnaire for all the unit of TPE, and we classified the tools and elected a top 10. I will present you this work. So I work with Dr. Dupré, which is a dermatologist, and she realized some collective atopic dermatitis TPE session in breast, and she asked for the unit of the west of France. Then Sophie Marie, who worked in Fondation Eczema, asked for the south of France. Virginie Verdu, nurses, work in University Hospital of Lyon, and she realized some collective session of TPE in this unit, asked for the east of France, and I asked for the north of France. So we sent to every TPE unit a questionnaire to have the name of the tool used, the pedagogic aim of the tool, and a short description to know how to use the tool, if the tool is used during individual or collective session, if it's used during a medical consultation or between two medical consultation, and then we match 4 categories of the different tools, which I will explain to you after. We wanted to know which was the population targeted, if it was for children, for their parents, or for adults, and in which sort of format you can have the tool, which type of tool, and where you can find it, and who create the tool. So we were surprised because, as you see, a lot of towns with a red cross don't practice atopic dermatitis TPE, and we references 186 tools, but some were common between different TPE units. So we listed 115 tools. In this 115, they all were different, but some were tools which were created by the unit, but it was the same between two different TPE units. So I will describe you all the top 10 of the French tools most used, and all these tools were the same or similar in each unit in French. We, with Dr. Dupré, Virginie Verdu, and Sophie Marie, we choose to classify the 115 tools in 4 items. First, if the tools is used to improve the knowledge of the atopic dermatitis disease, if it's to involve the patient in the care protocol and to improve his therapeutic adherence, or if it's used to assess the disease progression. And we, in the top 10, we want to select at least one tool of each category. So the most tool used, it's the Eczema book. The Eczema book, it's just some pictures. We represent the skin as a brick wall, and the bricks are keratinocytes present in the epidermis. And in atopic dermatitis, there is a disruption of this brick wall because there are less cement, and so we need some builder to improve the barrier, and the emollients are the builder. After this Eczema book represents the inflammation with some fire, and the fire are between the keratinocytes, and the patient have to use the treatment, and the topical or systemic treatment are the fireman, and he had to use the inflammation of the skin, the lesion of the patient are like a forest fire, and firemen have to work since there are no amber in the forest, and we have to use the treatment and the proactive treatment 2 days per week, to calm the inflammation and to put out the fire in the forest. So this tool is really useful to have a representation of the skin and the two disorders in atopic dermatitis, the disruption of the barriers and the inflammation. And to represent the Eczema book and to use it in everyday life, there are some stickers, one for emollient, and it's the builder, and the other, it's a fireman to the topical treatment. And when the children have separated parents, or if they go to grandparents' house, it's really useful to identify which is the emollient and which is the topical treatment. After that, we can propose to the patient a personalized care protocol to implicated the patient, and he had to know when there is a flare-up, when he have to put the cream, and if it's some topical treatment or if it's some emollient, and how many per day, and once a day for the corticosteroids, and everyday life we have to put the emollients. To know how much cream you have to apply, we use a knuckle unit, and we say to the patient, a man, to a full body application, you have to use 30 grams, it's one tube, but the equivalent between 2 palms of hand is one knuckle application of cream. So it's really useful for the parent or for the adults with atopic dermatitis to know how much cream they have to apply. Another tool really useful, each TPE unit can create his own tool. It's a true or false. It's just to question the patient and to identify wrong questions they have and wrong answer they can apply and they can have in our head. So it's just to discuss and to deliver true information about atopic dermatitis. This other tool, it's useful between two medical consultations because the patient can download it on his phone and he can realize it between two consultations to evaluate and to score the intensity of atopic dermatitis. And for us, when we see the patient, it's really helpful to know if the treatment is useful or if we have to intensify it. So the other tools really in each TPE unit, we use these tools. It's to give to the patient some tips against itching. They can apply when they are in flare-up and they want to scratch their skin. They can apply a spoon or some stones, and they can put it on the fridge to have this sensation of cold and to calm the itch. And also they can use some water spray or other tips, but we have to inform the patient who don't know it to calm the inflammation and the itching sensation of their skin. And another tool that each TPE unit who propose atopic dermatitis TPE used its cream bar is to show to the patient, and the patient can touch the different texture of topical treatment, not only for treatment, also for emollients. And from the oily to the more oily to the less oily, they can see that ointment, cerat, cream, gel are different, and they can choose if they want to apply on their skin in everyday life the good emollient. After, we also used some pictures, some posters, some also we can make a picture on a wall, and you can present this type of tools. You can see first the normal skin with cohesive cells and with water in the skin, and atopic dermatitis skin where there is a non-cohesive cells, a disruption, and a loss of water and some inflammation. You can go into the skin, and there are more and more inflammation, and the skin begin red. And the last tool, it's specifically for Dr. Dupré because it's his own tool. It's a fireman certificate because it's important to encourage the patient to do well. And if what we want in a TPE unit, it's to implicate patient and to be active in our own disease. And what we see with this work is there is a lot of tools, a lot of different tools. Each TPE unit choose their own tools, and they can appropriate them for her, and they can use as they want. But the top 10 show that there are similar tools between different units, and the tools, the aim is to explain the physiopathology of atopic dermatitis, if to have an adherence of the patient to the care protocol, if we want to that the patient know how to apply the treatment, and mostly we want to adapt the treatment and the everyday life to the wishes of the patient. Thank you for all, and I want to have a special thanks to my teams in Bordeaux, and we enjoy to propose a TPE session for our patient because it's really, really helpful. Thank you.